Hi everyone, welcome to this short video to compare between potency and efficacy. And let's start to know the differences between potency. My name is Ahmed. Potency is the effect of a drug per unit of weight. So here we are talking about the dose or concentration of the drug that produce the effect. However, efficacy, it indicates the maximal or the ceiling effects produced by giving different concentration of a drug. So how much or how effective is the drug in producing the desired response? It's better to show these differences using curves. So in all upcoming curves, in the x-axis we have either the dose or the concentration, and in the y-axis we have the effect or the percent response. In this curve, it shows the differences between 4 different drugs, A, B, and C, and D, regarding potency. So as we can see, there are some curves are on the left, some curves are on the right. To measure the potency, we simply look at the maximum effective effect, which is around here 100%. We draw a line at the 50% and we start measuring the EC50 for each drug. So for drug A, this is the EC50, this is the EC50 for drug B, this is for drug C, and this is for the drug D. And as we can see here, that drug A needed lower dose or lower concentration to produce the same effect produced by drug B, which is less than drug C, which is less than drug D. In this case, we call drug A has higher potency compared to drug D because it has lower EC50. On the other hand, to measure efficacy using this graph, we have both drugs, drug A and drug B. Here we can see that the maximum effect of a drug A shown in green, and then we have the maximum effect by drug B, which is shorter than the maximum effect of drug A. In this case, we call drug A has a higher efficacy compared to drug B. Please look carefully that we're looking at the maximum possible effect regardless of the dose, which means until we reach the plateau of each curve, then we can compare the ceiling effects. On other topics, drug A can be called as a full agonist, and drug B, you can guess that it can be called as a partial agonist. Finally, for this slide, we want to compare between efficacy and potency for all these drugs, let's say drug A, drug B, and drug C. To start with the efficacy, we can see the effect of drug A is much higher than the effects of drug B and drug C, and thus drug A has higher efficacy compared to drug B and compared to drug C. To measure potency, we can just draw as we did before, which is a line at the maximum possible effect. We take 50% of that and we start measuring the EC50s. The EC50 for drug A, which will be at this point, it's going to be much higher than the EC50 of drug B. Now there is another term for EC50, which is the KD. This is the KD for drug A, this is the KD for drug B. The KD for drug B is less than the KD of drug A, and thus drug B has a higher potency compared to drug A. Now some of you may ask, how about drug C? Because it did not reach the 50%. Well, if we want to measure the KD for drug C only, we just do the same thing. We draw a line at the maximum effect by drug C, then we take 50% of that, we take the vertical line, and then we measure the KD for drug C, which is going to be 0.01 milligram per kilogram. However, I want to draw your attention that, as you can see, the maximum possible effect of a drug C did not reach 50% of the maximum of the effect of drug A or B. And thus, it is not clinically relevant that a drug has a high potency, but it has very low efficacy. It will not help us to produce therapeutic or clinical positive effects to patients, and thus such a drug is not beneficial when pharmacologists try to look for good therapeutic medications replacing current medications. So For exam purposes, when you measure KD or potency for drugs, you just draw one line at the top of the highest possible effect, and you take 50% of that. If the curve did not cross, that means this is not a good drug, and thus it does not count toward being a good drug. And thank you.